I'm Dr. Katisha, your triple board certified hematologist, medical oncologist, and internist. I help cancer patients and their families cope from diagnosis to treatment. So very often, once a cancer patient has received a diagnosis, one of the most distressing things about the diagnosis is actually that office visit with the medical oncologist. So I want to talk a little bit about what you can expect in that very first visit with your medical oncologist. One of my first tips is that I definitely think that you need to bring someone with you, but not too many people. Sometimes if you have way too many family members with you, it can actually be a bit distracting. So bring one or two close family members with you, or a friend, somebody who can hear what the medical oncologist is saying, because you'd be surprised. Very often, you as the patient will hear one thing, your friend or family member will hear something completely different. Number two, make sure that you write down your questions before your visit. Very often, because patients are overwhelmed by the office setting, they forget all of their questions when they arrive. So if you have those questions written down and have an opportunity to go through each one of them with your medical oncologist, I think you'll be much more satisfied with your visit. Number three, expect that your visit will be fairly long. So sometimes patients will expect that their visit with a medical oncologist or some other specialist will be like their visit with their primary care doctor, which is often just 10 or 15 minutes. Because there is so much information to go over with your medical oncologist, you might expect a visit that's 30 or 45 minutes long. In case you have treatment, your visit may be even longer, so make preparations for a long day. Number four, please make sure that you know your family history. While it may not seem terribly important to you, for the medical oncologist, it may trigger some things that lead to different tests, or it may even trigger some things that lead to different treatment options. So knowing if a family member had a particular type of cancer and the age that they had that cancer will be very important for your visit. And finally, number five, make sure that you have a list of all of your medications. Very often patients will think that their list of medications from their primary care physician's office or from the hospital will automatically be linked to the medical oncologist's office. Unfortunately, that's not the case. Help us to do our very best for you so that we know every medicine that you're taking, making sure that there are not any important interactions between chemotherapy and the medicines that you have to take every single day. I'm Dr. Katisha. Thank you so much for listening, and please make sure that you follow me on drkatisha.com. Thanks.